Hello there. My name is Casey, and I'm one of the managers in surgical services at Chris's St. Vincent. Today, I'm going to explain the pre-admission journey and what you can expect the day of your surgery so that you can be prepared. After your surgery is scheduled, you'll receive a phone call prior to your scheduled surgery date from our pre-anesthesia department to review your medical history medications. You'll also receive a phone call the day before your surgery in the late afternoon prior to 6 p.m. from our pre-admission department with your arrival time and specific instructions for the day of surgery. It is important that you follow all instructions given. If you're to be sent home the day of your surgery, you should have a responsible adult over the age of 18 present to receive your discharge instructions and drive you home. If you don't have someone to take you home, you will need to arrange for medical transport. This must be done prior to your surgery date to prevent cancellation of your surgery. You will not be allowed to be discharged home in an Uber, taxi, or bus after surgery. If you have POA or guardianship paperwork, please bring that with you on the day of your surgery. If you don't have that, it may delay or cancel your surgery. On the day of your scheduled procedure, please proceed to surgical services. A map is located on the preoperative instructions that were given to you at the clinic. Come in the front doors and check in with our receptionist. You will need to provide your ID, insurance card, and form of payment if applicable. If you are unsure if you need to provide a payment, please reach out to the Chris's St. Vincent business office. After you've checked in, a pre-admission staff member will pick you up from the waiting room. You will be asked multiple times for your name and date of birth. This is to ensure your safety during your surgical journey. Upon arrival to the pre-admission area, you may be asked to leave a urine sample if you're of childbearing age and have not had a full hysterectomy. We will also obtain a height and weight and then escort you to your pre-admission suite. Your pre-admission nurse will then hook you up to a monitor to check your blood pressure, heart rate, and oxygen level. An IV will also be started with fluids to hydrate you, and you may be given some pre-admission medications if prescribed by your physician. Blood samples may be drawn at the time of the IV insertion if needed. Your nurse may place a compression stocking or a compression device on your lower legs if ordered by your physician. You will be asked many questions pertaining to your medical history. An anesthesia provider and surgical provider will stop by your pre-admission suite to discuss your plan and answer any last-minute questions you may have. You will also be asked to participate in a timeout with your pre-admission nurse and your operating room nurse prior to leaving this area. The timeout simply will consist of you verifying your name and date of birth, as well as the surgery you will be having. Please be patient with us as we strive to provide the best and safest care to all of our patients. We may need to spend additional time on yourself or another patient, which can cause a delay. We recommend that you bring a book, tablet, or cell phone to help pass the time. As always, we thank you for choosing Chris's St. Vincent Surgical Services for your surgery today.